Well, welcome, Lily. I'm Dr. Bio, and I'm so grateful just to have you here with me today to talk about your experience with healthcare, your experience with your recent diagnosis, just the opportunity to help people, which it warms my heart. So I would love for everyone just to get to know a little bit about you. And I was amazed by all the amazing things that your heart puts forward in respect to nonprofit work, volunteer work, all of the things that you do. There's this cross pollination that I see of giving back or giving to others. And here you are today helping people as well. And so, welcome. And I would love for people to know just a little bit about you.
Well, thank you for that.
You're welcome.
Gosh, I'm going to say my age because I'm not ashamed. I'm 61 years old. I have two children. They're 33 and 37.
Uh-huh.
They live here in Reno. I work for a local organization that helps nonprofits just love people. I love helping. I've been involved in nonprofit work off and on since the 90s, I believe. I have a heart for animals, though. Our animals have been my passion. I worked at a couple of nonprofits in Reno that I helped rescue animals and do events to bring awareness to what animals go through. I ended up rescuing a dog that had been severely mistreated, a pit bull, and working with her, I learned a lot about just accepting things and people for who they are.
Yes.
So
I would love to know a little bit more about animals in your life, like first animal, first dog. Where did that start? Where did that originate?
gosh, I wish I knew. So growing up, we came from Chicago, and my mom had a poodle, and he was really spoiled. And so that's not where that started. But I always, beyond that, was aware of animals in need. Growing up as a child, if I saw a cat, walking around the neighborhood, I would, try to talk to the cat and feed the cat. Um, as I got older, I would stop along the street and, pick up animals that were lost or just wandering and just very aware of their suffering. So as I became aware of opportunities in the community to change jobs, and I was actually changing from a job working for the casinos doing events
Hmm.
and enjoying that, but I was given an opportunity to go into nonprofit work helping animals. And it's like, do this or be helpful, do something that saves lives. And it was a no brainer for me. And I jumped into it with both feet. And I think I cried every day at my first animal welfare job.
Oh,
And I asked the executive director, am I ever not going to cry working here? And she said, if you ever stop crying, it's time to go. That means you're immune to the suffering and things of the animal. So I just always, even though I haven't worked in animal welfare for a while, I still do things. I still trap neighborhood cats that need to be fixed and get them medical care and that sort of thing in my neighborhood.
I really loved how you mentioned, often we hear about with different careers, different places where you feel like you can't be yourself or really kind of embody what you're feeling with whatever work you're doing. And you had mentioned, when you said, is it okay if I'm crying every day because I'm seeing all these things? And they said, that means you're feeling it, you're doing the right thing. And I think we can all learn from that because I think about healthcare and there's often this kind of thought that we have to be a certain way, that we can't feel, we can't. But I think those who do embrace that, it makes us better people first and better doctors or better whatever we're doing. And so I think that's something to like hold on to
That's
and
great.
think about and putting forward. I'd love for everyone to hear a little bit more about your health journey and some of the things that you are going through right now and even from the start.
Great. Well, I'm happy to share that. Hmm, this is tough for me because it's a really new kind of serious thing in my life, but it started back in, gosh, 2017, and I had 5 gout attacks in my left foot during 2017 that lasted a week or more. severe gout attacks. And they were treating the gout, with, I guess it was steroids, and it would get better. And then it would come right back. And it would come back again and again. And I was on a knee scooter. It was terrible. And so I finally, towards the end of 2017, said, something's not right with the healthcare I'm receiving. Something else is going on. So I left the doctor that I was seeing, and I actually went to, I believe it was St. Mary's Urgent Care, and asked if they could just run blood work. And they were, what? Just like, something is going on with me, and can you just run blood work? And so they ran my EGFR, and I don't know how to pronounce all the.
No, you're good. You got it.
But basically, one of the tests was to run my kidney filtration rate. And they ran that, and they gave me the results, and I didn't know what they meant. So I found a new doctor. And on December 1st, 2017, I walked into her office for the first visit, handed her my results, and she said, your kidneys are failing. Okay. So we have to save your kidneys. Okay. So, and she started rattling off, do this, no more beef, no more pork, no more dairy, just rattled off all this stuff. And I think I captured all of it, basically. I didn't write anything down, but I remember going out to my car and just crying. And I called my son, I called my daughter, I called my sister, and just, she's saying, my kidneys are failing and we have to do something. And so all the things that they told me to do, I did those things. I lost a lot of weight. My kidney number held. They referred me to a nutritionist. They referred me to get some ultrasounds of my kidneys to check for polycystic kidney disease, which I did not have. They sent me to a nephrologist, and I still see her to this day. And they kind of got it, they got me stabilized. And they checked me every now and again, and I was holding. And then in 2019, I started feeling really, really sick, to the point that I could barely walk. I could barely speak. I couldn't comprehend like complex anything. I was working full time. If I read anything, I had to read it 3 and 4 times. And I was working in legal contracts at that time. And I was struggling. And I would do things like walk against the wall and use my hand to look like I'm fine, but I was not fine. And after a year and a half, this is well into the pandemic now, I found out that I had drug-induced lupus, which I was told meant that these antibodies were attacking my healthy tissue, which is why I was exhausted and couldn't speak correctly and all this stuff. So they treated me for that with hydroxychloroquine, and that's probably the generic name, and it went away, but we never went through what brought that on. Let's do the elimination of what medications you're on and just figure out what brought that on. So I kind of spent the next couple of years just getting my feet back under me from feeling really sick all the time. And let's fast forward to this year. I hurt my back just out of the blue, woke up and I was in horrible pain. And I went to a local orthopedic clinic, and they started running tests and doing scans and things. And they ordered an MRI. And on the MRI, they could see some cysts on both kidneys. So they said, go back to your nephrologist. And they ran some more blood work, and they said, your EGFR is now at 22%. And you are in stage 4 renal failure. So, okay. And then they sent me for a biopsy of my kidneys. That was agonizing, waiting for the results. But I got the results from the doctor, and it was also alarming. They made me an appointment, and then they bumped it up, and then bumped it up again. So it scared me to death. And I finally went in, and they told me that I had scarring on both kidneys from having high blood pressure. And I've had high blood pressure since I was 30, and I've been on medication since I was 30 years old. But apparently, they told me even that little bit of 140, 150 instead of that 120 was enough to damage my kidneys. So they told me that they can't be repaired, and I'm basically a stage away from having to make a decision to do a kidney transplant or dialysis. So that was 2 weeks ago, and I've cried a lot at accepting that my life is about to change. And there really isn't much I can do about it. It's kind of past the point of no return, so to speak. They did put me on a new medication, um, Farxiga, which apparently could help slow the deterioration of my kidneys. Um, they're hoping. So I'm taking that, and I'm not eating certain things. And with the Farxiga, I have to drink a lot of water. So I'm doing all those things, but I'm scared.
Well, first and foremost, I just want to say thank you for just even walking along or this health journey that you've had. I was really like inspired where you are having this information come at you over and over. And you're like, okay, I'm just doing this. I'm going to do this. I'm going to do whatever I can for my health. And this kind of disjointed system that we have makes it so hard for patients to be able to navigate. And here you think, I'm on the right path. I have high blood pressure. Okay, but it's being treated, but not knowing that that difference of 10 to 20 can make a huge difference. And then just having you here today to share so you can help others know about your journey. And anyone listening may think, oh, I'm going to check this. I'm going to see how, if my blood pressure is 150, it needs to be 130. Or maybe I have lupus, maybe I have that. I knew your story would be reflective of why you do what you do, even from before and even now, because it's all centered in helping someone else. And it's just powerful. And the fact that this is news that you just received just a couple of weeks ago, it's hard. And I want to help because, as a primary care, my goal is to just help try to center all of these things that are happening. And so when we talk about the gout attacks that you had, and I think by breaking it down so more people can understand what that embodies and how that can also be reflective of something else like kidney disease. And so having the swelling, the pain in your feet can also be a sign that your kidneys are not working as well. So our kidneys, they're there to filter and kind of get all the toxins and so forth. But if they're not functioning as well, you can have pain, you can have swelling in your feet. And certain medications, unfortunately, can also be harmful to your kidneys. And when we don't know that, we don't change or reduce the amount of dosing for your kidneys. So when you were sharing with me with the gout, and then you had the steroids, but you didn't know that there was kidney disease. So all of those things just kind of stacked up. And it was really difficult for your kidneys to be able to respond. Um, but I'm just so grateful that you're here and to share that. There's a piece that I want to talk about, Lilli, and I'm just curious as we kind of talk about advocacy and kind of being able to know what's happening. When you were told about your kidney disease and so forth, they told you what to do, but did they tell you why they thought you had it?
No, they did not. They didn't share that. They just said, you have it, and this is what we need to do.
So the reason why I asked that, and I thought I would have the answer that you shared is, I think healthcare, we forget that piece. You need to tell the patient why you think they had it. Because when you can understand and feel like, okay, this is why this happened, with so much lack of control, especially in healthcare and other things in our lives, if you feel like you can have that information of why this could have happened, it helps you kind of put that into perspective. I don't know. Tell me your thoughts.
I would agree with you on that. And another thing that I went through in this journey was the amount of non-prescription medication that's just out there that we take for different ailments, and we don't know that it's damaging to the kidneys.
Yes.
And in my kidney journey, my nephrologist said, when you have anything, if you have allergies, um, whatever it is, ask the pharmacist, is this kidney friendly? Don't just walk up and grab something off the shelf and take it, even if it's something that you rub on your skin or that you put in your nose for allergies. Ask questions, because ibuprofen,
Yes.
it's a non-steroidal anti-inflammatory, is damaging to the kidneys. I learned that one of the medications I was taking for acid reflux was damaging. I've been on it for years. Was damaging to my kidneys. I forget, Neprazole. Yeah. Um, and then I also have bad knees. I'm bone on bone here, and they were going to give me um, a steroid, or like an NSAID for my knees, and it was Voltaren. And they said, just, take a bunch of, I said, but I have kidney disease. Oh, then we need to measure. So here's this little ruler thing, and measure this much and use that. Don't I'm like, but it's on my skin. Right. It can be absorbed. And it was just so eye-opening. And if nothing else happens out of this, if people could just be aware that some of the stuff on the shelves is not for you. And that's why you need to know why you have kidney disease or whatever, and how these medications could affect you. I even learned certain foods I should not eat, because eating them in excess could damage my kidneys. So it's just this whole, I don't know how to explain it, but it's just,
It's a new ecosystem.
yes, this constant awareness of, can't eat that, shouldn't eat that. But it's empowering also when, here's a couple of, I can't take that. So I would encourage people, um, I've been preaching this now for 2 weeks, go to the doctor. I told my brother's 70. He lives at Tahoe, and seems to be very healthy. And he said, I'll give you a kidney. I said, great, please go to the doctor and get a baseline. Have him check everything.
Yes.
From the top to the bottom, your blood pressure, have him run some blood work. Because at a certain point, if you've had something and you didn't know you had it, you might be past that point of no return.
And that part is important. I often share, we know ourselves and we know our bodies, but there's so many different diseases that are silent that you don't know about. And I think there's power in at least knowing, because once you know, then you can decide whatever you'd like to do with your healthcare. But having that information is powerful to be able to make those decisions. And another piece that I love that you mentioned is, thinking about a renal or a kidney diet. We forget that all of the medications over the counter, all of these things can impact our kidneys, and they're, inside our bodies. It's kind of silent, but people don't realize they are a part of our overall powerhouse. I think of the brain, the heart, the lungs, the kidneys. Those are the things we need to really be able to do what we would like to do, just function every day. And if one is not in alignment, or one can't do what it normally does, as you mentioned, it can really impact your entire life. And although you said, there's nothing that you can do now, I feel from you that you are doing something right now. You have already created a roadmap, and it's something that I encourage patients to think about. Okay, I was told this, this, and that. What can I do in this space? And you're like, I'm doing the water, I'm doing everything I can. And that mental power, I just want to gift that to you. I feel it, I see it, it's working. And even though this is fresh, you are in this to save your life and to do whatever you possibly can and save your brother's life and save other lives just through that information that you just shared and how you told them, go to the doctor, get checked. And another thing that I like to talk about is, yes, it's important to go to the doctor, but also to empower yourself with the information. And so I tell patients, ask that doctor what they're ruling in and what they're ruling out when they're checking tests, when you share certain symptoms that you're having. And then also ask them, what is your plan based on the results?
Mm.
That way, you can start thinking about, this is where I may need to go. This is where I really need to make sure I stay focused on, because that can also help get things going even faster. Because all of those things, when we can have that power within our own health, it can be amazing. So, is there anything else that you'd like to kind of just share in general?
Just the importance of, if you can't have someone advocate for you. I had a health issue a number of years ago, and they thought I had cancer. They thought I had ovarian cancer. And my daughter at the time she worked for Planned Parenthood. And when I told her, she jumped and she's like, I need to advocate for you. I'm going with you to your appointment because I know you're not going to hear anything and you're going to forget what they said, and I got you. And if you don't have anyone that can advocate for you, you have to advocate for yourself. And even sitting here talking to you and telling my story, I realized that in some small way, I did that by going, this is not normal. We need to check this out. And why can't I function properly? And it's okay. You don't have to be a jerk about it. You can do it in a loving way. But if you don't do it, who's going to do it for you? Also, um, just even understanding what your numbers are. I went back and did research, and there's, a tracking system here well, I guess the whole country has it, but where your lab results go. And you can go in there yourself and look at that. So I went in and I looked at a chart for my trends, for my kidney numbers, and they had been going cuckoo for a long time before I was diagnosed. And I'm like, why didn't the doctor that ordered these tests say something? When it started slipping down below 60 and then down to like 40 something, that's not normal from what I understand. Why didn't you say something? Why didn't you order additional tests?
That part is so important. You hope that that clinician will be your advocate, but in the end, you have to be your own advocate. You've got to watch those numbers, watch what's happening. And that's when I share asking them, what is your plan? Because who knows if they're going to check those numbers like they should be. So that way you've got that blueprint, that information in the back of your mind to go forward and know this is not normal, this is normal, and where I need to go. And when I think of African Americans and how we are disproportionately impacted by kidney disease and hypertension, heart disease, when I look at this full circle, it reflects bias, it reflects literacy, and it just reflects the ability to be able to advocate for ourselves in a system that is fractured. Unfortunately, African Americans are, as I mentioned, disproportionately impacted by renal disease. And when we talk about the number or the GFR, which you said, for years, and it's still impacting African Americans to this day, there was a Black versus non-Black.
Yes.
And just based on the color of someone's skin. And this is something we've been advocating for, I've been advocating for, but I think hearing the stories, because people hear these statistics, but they don't put together, this is someone's life. And the fact that there is this number or range that has grouped people together based on you're African American and you're not, and we're going to decide who has true kidney disease and who doesn't. And that has cost lives, that's cost generations because we didn't have the opportunity to know in advance. And then digging a little bit deeper, when I look at your story, you were already at a disadvantage based on being African American, and then the bias, and then not having that clinician follow through. And hypertension, all of those things impact your kidneys. So it's full circle. When we have from the start a unequal or not imbalanced system, how are you supposed to be able to get equitable care?
I'm glad you talked about that. I've been Googling a lot, and I did find that study, and I was shocked. And I remember seeing on my tests, if African American, you're here, but if you're non, this number. It's like, okay. But my recent tests don't show that. It's basically, here's your number. And it's shocking.
It is, yes. And think about if you would have saw those numbers before, even if you were in full kidney disease, you would have been considered not, but somebody of a different color would be. And that's the thing people don't realize, that it is continuing to impact. And the other thing that I like to share with you, because I shared, I'm going to give you all that I can as far as information. People are not aware that when it comes to blood pressure, there is a protocol or a recommendation, a guideline that African Americans or Black patients get a certain class of blood pressure medications, which you probably haven't. Have you heard about this? And so I'm going to go a little bit deeper. So it's recommended that you get two certain classes versus everybody else would have all of the other classes. And it was based on these studies that didn't reflect genetics. It reflected the color of your skin, saying these two medicines would work better in an African American, actually a Black patient, I'll be specific, for their blood pressure. So imagine you go in, you have high blood pressure, you're given this medication because that clinician sees you as a Black individual, and you're like, it's not working as well. Okay, well, I'll give you a different one, or the same or more of that same one, versus Lilli, all of the other ones that could have controlled your blood pressure sooner, faster, less adverse effects. And so this is something that, I'm advocating for change, because we'll put those dots together. Uncontrolled high blood pressure leads to kidney disease. Uncontrolled high blood pressure leads to heart disease. All of these things are all connected. And if we can't really dissect all of these layers of bias, inability to access things or know or advocate, how are we supposed to be able to, have that equitable care? So I share that with you in hopes that you, what you're already doing, share it with others, because the more you know, the more you're able to advocate for yourself and anyone that you know.
Wow. Thank you.
You're welcome. Yes. Well, thank you so much for just your time, your energy, and sharing your story. I really appreciate it.